Hi guys, welcome to Nursing School Masterclass. My name is Dr. Jamie Adam. I'm so glad to be with you this evening. So last week, we were talking about Ask Me Anything Nursing School, and several questions came in and too many to respond to in one video. And so this is part 2 of that. And first of all, I just want to start by saying I was in nursing school, and so I understand the stress and how busy you guys are. And so I just so appreciate that you are spending a few minutes with me this evening. And I just want to thank you for that, and also know that I know how valuable that is, your precious time. So thank you for sharing it with me. My hope is to make nursing school less stressful for you so that you have more time for the people and the things that you love in your life. So tonight I'm going to get right to answering these questions. And I would just say, as you're hearing this, if you have questions about what I'm saying, or you think of other questions that are on your mind, if you want to type those into the chat while I'm speaking, that's fine. There is a little delay, so it's going to take a minute from the time you actually type it to when I get to see it anyways. So please feel free to do that. I will answer questions at the end. So there were several questions that came in from students that were struggling to pass their classes. And there was one in particular that said she has a 70 in her nursing class, and should she drop? Should she continue? What should she do? And so I really want to focus in on that question, because there were multiple students that wrote in with a question about being on that line. What do you do? Do you withdraw, or do you push through and keep going? So tonight we're going to talk about that. So first of all, depending on your school's policy with withdrawal, essentially what that ends up being like is as if it's a failure. So for example, if you withdraw from class, you can't progress in the nursing program. You have to repeat it, just like if you failed it. So you have to repeat it. You can't progress. It slows you down. It changes your graduation date. So it really is a really stressful situation to be in. However, sometimes it can be really helpful. So if your program allows you to withdraw without treating it like a failure. So usually this happens if you withdraw very early in your program or very early in the semester. So you probably have a period of a couple to a few weeks in the beginning of the semester that you can withdraw, and it doesn't count against your GPA. Yes, you can't progress in the nursing program. Yes, you'll have to repeat the course, but it doesn't count as a failure, and it doesn't hurt you as far as putting you at risk for dismissal. So you need to know what those dates are and those deadlines and how your program treats that withdrawal. So I would start by asking that course professor for information about what would happen if you drop the class at this point in the semester. You could also ask your advisor. And then if you weren't able to meet with those faculty, then you could even approach the director of the program. So the director of your program would also be able to give you information about what would happen if you were to withdraw at this point in the semester. So, and really, you think about it, there's pros and cons to withdrawing. So if you can drop that class and not receive a failure, then that could be a really good thing. There's some advantages here, right? That means you can take the time that you were spending in that class where you were struggling. You could take that time and shift it to another class. And this is really important if you find that you're struggling in more than one course at the same time. Then being able to put all of your attention eggs, so to speak, in that basket of that class that really needs your attention could be a really good thing. So that could be an advantage to dropping that course. The other thing is this gives you some time back, maybe for your own self-care, for time with your family, your friends, if you have relationships that you're needing to focus on, maybe relationships that have been strained due to you being in school, then dropping a class could be really helpful for that. It could also give you time back for your health. So if your health has been a factor, again, that could also be an advantage. So really when it comes to the cons or the reasons why withdrawing from a course could be a problem is, yes, number one, it means you can't progress and you have to take that course before you can move on. So this means it's changing your graduation date. This also means that that your cohort is going to change. So those students that you were doing classes with, they're going to move on, and you're still back in that semester where that course is, having to retake that course. Now, that's not always a bad thing. So it's hard sometimes to see your classmates move ahead, but in other ways, it releases you from some of the stress and strain that you might feel with comparison among your classmates. If you're feeling that comparison trap, if you're feeling competition there, then that can be helpful. If maybe you've had some difficult relationships in that class where maybe you encountered incivility or bullying, then it can also be a relief to be removed from that group of students. So it's not always a bad thing to have to change cohorts. So the other, way of looking at this as well is, if it's counted if it's counted against you. So let's say you withdraw and it's counted as a failure. In that case, you have to look at your admission and progression requirements for your program and see, okay, if this is considered a failure, then how many failures can I have before I'm dismissed? If this is my if this is counted as a failure and I haven't had one before, then this could be okay, but it also puts more stress on me to make sure I don't have any other failures in the program. So I feel like I kind of shared all around that topic so that if this is a question that you have where you're trying to decide, should I stay in the course? Should I drop the course? Now you have some things to think about that can help you feel more educated in making that decision. So, and thanks so much for sharing that. I know that that's a stressful place to be in. And so I appreciate that. And one other piece of advice with that is that before you make that decision, that you take some time for some self-assessment and really think about, okay, what is contributing to this failing grade? So what were the factors that have affected me this semester? What do I think are some of the key problem areas? And then, number two, think about what changes you would need to make going forward. So, how are you going to change your study habits? Do you have accountability? Do you have other people that are supporting you? Do you need a tutor or need to reach out for a peer tutor from your program? And then also, are you willing to make the changes that you would need to be successful? So sometimes, when you see what the issues are that are affecting your ability to pass the class, and you see what you would have to do in order to change that, then you also have to factor in, are you willing to do that? Are you willing and are you able? So there are certain things we can't control, and then there are other things that we can. So definitely thinking about the things you can do, the things you can control to help your success in that class. Okay, so question number 2. This came in. I had multiple questions about how to study in anatomy physiology, and then I also had questions on how to study in patho or pathophysiology. And I put those together because the way you study for A&P is very similar to the way you study for patho. So it's a lot of the strategies are going to be overlapping and the same. So when we talk about anatomy, you're learning body parts, you're learning, how things are named, you're learning muscles and bones and tissues and all of the structures and organs, and it's a lot. So it's a lot of memorization, and it's really hard to get away from the memorization because you're memorizing a lot of names and locations, and so a lot of times with that, it's just repetition and practice. It's if you have a anatomy lab where you're able to visualize and practice kind of hands-on where the different body parts are and placements and names, then that's a great way to practice. Sometimes using flashcards can be helpful because it is memorization, but a lot of it is just practice and repetition, and it takes a lot of focus to do that. But Unfortunately, the physiology side, so anatomy, physiology, the physiology component of that class is going to be very process oriented. So this is how the body works, how the body system functions normally, and that is very process oriented. In the same way, pathophysiology is very process oriented, and so it's really focused on, well, what happens in a disease process? What happens to that normal body system when there's a disease process at work? How does that normal body system change? How is it affected? So physiology and pathophysiology are very process oriented. The benefit to being process oriented is it's something it's something that you can understand. You can learn the system and understand the process, and it's much easier understanding how things link together than it is memorizing just isolated body parts. So you may find that physiology and pathophysiology are even just a little bit easier than anatomy. So, okay, when it comes to studying these, and it's so important that you really understand A&P and Patho because they really are foundational to every nursing class. Because as you think about it, as you're learning about a medical condition, it's really helpful for you to know, well, what should the body normally sound like or look like or feel like? And then what's happening in this disease process, because that's how you learn the signs and symptoms of a disease. So really strengthening your understanding of these topics is going to help you in every class going forward. So here are my suggestions for how to study in A&P and Patho. Okay, so the very first thing I want you to do is when you're taking notes in class or from the reading, I want you to illustrate your notes. So this is where you draw little visuals next to your notes as you're taking notes in class. So an example might be you're learning about something cardiac related, so you draw a heart next to your notes. Maybe you're learning about kidneys or kidney function, and so you draw a kidney bean next to your notes. Or you could draw, if you're learning something respiratory, you draw a pair of lungs next to your notes. It doesn't have to be, you don't have to be artistic, but the idea is you're starting to introduce little visual cues that will jog your memory later when you're thinking about that body system you have in your memory. Oh, I remember this part of the notes. It was talking about how perfusion works in the body, and I remember that red heart, and I remember drawing this thing, and it comes back to you. And so that will help you remember the information if you just start by creating visuals, little, small, simple visuals in your notes. And then as you advance in your studying, being able to connect those visuals together in a concept map is so helpful for condensing that body system onto one page, so that when you're learning respiratory system or you're learning about the physiology of that you've got all that information right in front of you, all condensed in a nice format that you can remember. So the second thing I would encourage you to do is to color code what you're learning, underline, circle, star in different colors. Those are ways to start to group the information by themes. So whenever you're talking about cardiac, use red, underline, circle, star in red, and start to begin to associate certain colors with certain themes or types of information. So that's a way to help organize it in your brain. That also helps later when you start to concept map that information. It helps you connect the dots and put it together. And then the third thing is to explain those notes and those concept maps and those illustrated notes, those drawings that you've made, explain those to other people. Take the time and really explain the information to other people. So when you think about, learning about, let's say, how blood perfuses through the heart, you can take your time and you can stare at the illustration in the textbook. You can, focus in on just trying to memorize that picture of how blood moves through each chamber of the heart. Or you can take that time that you would have spent just sitting there trying to memorize, and you can draw it for yourself. If you take the time to draw it for yourself on a piece of paper, then you'll have to think about what you're learning. You'll have to think about, okay, where does it go from here? Right atrium, where does it go from there? That is so valuable. And that's how you commit that information that's in that textbook. That's how you commit it to your memory, is by actually doing something with it and using that drawing process. So whether you are artistic or not, just the act of trying, the act of doing that is a great way to commit that information to memory. And you'll never forget it. If you draw circulation, if you take the time to do that, you're never going to forget the order that it goes in, because you took the time to do something with those notes and actually turn it into active learning. So, okay, the third question is, what might you recommend nursing students do over summer breaks to further learning and practice? So I got a few questions like this. What should I be doing over the summer? Do I need to get a job in a hospital? Is that something that nursing students should do? So I'm going to give you three kind of ideas for where to go for summer jobs, or three ways of looking at it. So, and I want to start by saying, there is no perfect job for a nursing student. There are options. So I'm going to share with you three big options that you have for how you're going to spend this summer. Okay, so the very first option, which is probably the most obvious one, is you can volunteer or work in a patient care area. So whether that's inpatient or outpatient, you can do that. You can do that for practice. You can do that to apply what you're learning. What I find is that those jobs in patient care areas are really, really good for students that are just starting out and could really benefit from the confidence of speaking to patients, the confidence that comes from taking vital signs over and over and over to strangers. That's really good. Getting some confidence with some of the psychomotor, the I's and O's, some of those other basic skills. So that's another reason why getting a job in a patient care area would be really helpful for a nursing student. So, and really, there's internships and externships, there's paid and unpaid. So you can do your research to see, whether, what you're looking for. And you don't have to stay in your own town or your own city. So you could go outside of it. You could go to a different state. Some of these kinds of jobs are really competitive. So if you are looking to do, let's say, an internship with the Mayo Clinic, then you want to do your research, find out when the deadlines are, what you need to do to apply. And really, if you do decide to apply for a job this summer in patient care, even if you don't get the job that you're applying for, it's great practice for putting together a resume and talking to a recruiter. And if you get an interview, that's even better, because now you get to practice an interview for a patient care job. And so that would be great practice for you before you graduate and work as a nurse. So that's all fantastic. Okay, but let's say you've had an extremely stressful year in nursing school. You have the summer off and you're feeling burnt out, and all of your friends are getting jobs at the hospital, and you're thinking, do I have to? Could I do something different? And let me tell you, yes, you can. You can. You don't have to do something in clinical care. You don't have to do something in patient care. So the second best job, I would say, for a nursing student in the summer is to think about working with the population that you are really interested in working with as a nurse. So if you're thinking about being a pediatric nurse, then think about ways you could work with children over the summer. So maybe that's in childcare, working as a nanny. Maybe that's volunteering or working at a camp for children. So really think about, how could you target the population that you're interested in learning more about and finding a job in that area. So whether it's nursing related or patient care, it might be something very different. But if it includes the population that you're passionate about, then that could be a great learning experience for you and help really round you out with other more insight into that population. So let's say you want to work in women's health. So maybe think about, is there an outpatient, women's health, or maybe or maybe a nonprofit that focuses on women. So is there a way that you could be involved with this nonprofit, and maybe it's not clinical or patient care related, but it has to do with women and women's needs. And so then you get to work with that population in a way that's not, necessarily direct patient care. Okay, and then the third idea when it comes to a summer job is, let's say you just choose something fun and it has nothing to do with the population you want to serve and it has nothing to do with clinical care. Is that okay? And yes, it is. So your summer job can also be a form of self-care. So I would make it something that you're interested in, maybe a hobby, maybe a passion, something that will fuel you and give you just give you joy over the summer after having had a very, very difficult semester or year, to where you get to do something that really helps stimulate your brain or your heart or your passions, whatever those are. So, maybe this is something that you know that there's a limited time for you to do this. So, something I've always joked about is that someday I'd like to work at Starbucks. Like, I just think that would be fun. And I feel like that doesn't make sense for me right now. But if I had a summer or two before I graduated nursing school and I wanted to do something just completely different and fun and interesting, then that would be the time to do it. So, I have students, we live in Nashville, so I have students that are involved in the entertainment industry. I have students that sing or dance or act, that are in plays and musicals. And that's what's so awesome about living here, is that their summer job might be in the entertainment industry, because they know that at some point they're going to be working as a nurse and it won't make sense for them to do that anymore. They won't have the opportunity to do that. So all that to say, your summer job, you have options. Don't feel like you have to do something clinical related. There are certainly benefits to that, but it can also be used for other things as well. And you have the freedom and the choice to decide. So I would encourage you to pick any of those options that sounds best for you. So, okay. I want to know in the comments, like, which of these resonated with you? What other questions do you have? And I have a few minutes to answer those. So I see a couple questions came in. Kristen, you asked, how do I organize my classes for the week? I find myself getting overwhelmed. Ah, Kristen, I know. Nursing school is overwhelming. So the way I see this work best for my students is getting a calendar out and scheduling not just when you're in class, but when you're going to study and what you're going to study. And then looking at it like every Sunday. So every Sunday, I'm going to look at the week ahead and I'm going to see, okay, these days I have class. I have a 2-hour pocket here. How am I going to use it? And being specific. So that way it helps you use those blocks of time really efficiently. And of course, in those blocks of time, you want to make sure that you allow yourself some margin. So I'm learning that 90-minute blocks are really good. So it's probably unrealistic to say, okay, I've got Tuesday evening off, so I'm going to study all night. So what does that look like to study all night? What might be better is to say, okay, I've got I'm scheduling 2 90-minute blocks. And in the first 90-minute block, I'm going to review these notes. I'm going to do this homework. I'm going to do this one assignment for this class. In the second 90 block, I'm going to do this other assignment, or I'm going to start on this paper that's due. So I think, breaking it down into 90-minute blocks is a good place to start. It feels like if you do 45 or 60 minutes, you can just get into something and then the time is up. But if you try to block off 5 hours to study, that just feels like too much time to try to work with. So you want to do it in blocks and give each block an assignment. So what am I doing in each of these blocks? And you'll find that some weeks you have more time than others. And so that's the benefit of at least once a week sitting down, looking at the week ahead and planning out how you're going to use it. And the nice thing about doing 90-minute blocks is maybe you did have all Tuesday night and you reserved two 90-minute blocks to work on things, but then, oh my gosh, you just got an email saying now you have a quiz the next day. And so something sudden comes up. Now you have to find time to study. But because you left yourself some margin, now those unexpected things that pop in, there's space for them. So that would be my suggestion. Okay, Litzy, you have a question. How about how to study for basic nursing skills and fundamental and how to practice critical thinking? Because we aren't born knowing critical thinking. Ah, I love that. That's true. Critical thinking is a skill. Okay, critical thinking is a skill. You can develop it, you get better with practice. I think sometimes when you hear people talk about being really good at critical thinking, really what it is, in life, you're always having to weigh information and make decisions. That's just life. So some decisions are harder than others. Some decisions include more factors that you have to think about. I think people that are naturally like inquisitive, they like to ask lots of questions. Sometimes they find critical thinking easier because they already ask 1,000 questions. But even if you don't find critical thinking easy, you can definitely learn to improve it, and it is a skill. So for these basic classes, so basic nursing skills and fundamental, you're really just beginning to use the nursing process, which the nursing process, a lot of it is just common sense. You are looking at the situation you have, you're trying to think about the factors that affect that situation so that you can then prioritize what the patient needs so that you know what to do as the nurse and how to make sure it's working for the patient. So that process of thinking about the factors, that takes time and experience, and the more you do it, the easier it gets. So sometimes, thinking about using the nursing process is kind of like a checklist. So, what is it about this condition? How do I know that this is happening? What are the signs and symptoms? What does that mean for the patient? It requires taking the time to go through each step and really think about each step. But the more you practice that on every condition, the easier it gets. One of the things that sometimes can be helpful with critical thinking is when you have practice questions, especially in the back of your book. A lot of times it'll give you the practice NCLEX question, and then there will be an answer key that you can look at that provide rationale. So I would take the time to do those practice questions and then read the rationale and see if you agree and understand with the rationale that's been given, because the rationale is really the way that textbook author that is a nurse that's written this is trying to explain to you how the nurse would think about that topic. So how does the nurse think about this topic? And that's where taking those practice questions and reading the answers and reading the rationale for why or why not each answer, why it would be right or wrong, is so helpful because it exposes you to how the nurse thinks. And if you know how the nurse thinks and you've practiced reading how the nurse thinks and you've practiced other questions in class, then you're going to get better at anticipating how the nurse would think in any given situation. So you're right at the beginning, and it does take some time, but it really will click. So I was talking to a student actually yesterday about how, when you go to ride a bike, you ride it, when you're first learning, you might get on it over and over and over again, and you just fall or you lose your balance. And then at some point it clicks, and that might be 40 times of getting on that bike. And so what you'll find with this is that you may feel like you're stumbling. What is critical thinking? How do I do this? Why can't I do this? And then all of a sudden one day you take a question and you just know how the nurse thinks about that. And it just clicked. And a lot of times that happens towards, I would say, the last third of your nursing program. That's when things begin clicking. So you're at the beginning, so everything feels wonky and awkward. But just keep moving forward, just keep taking practice questions and you will continue to learn and it's going to click. So, okay, does anybody have any other questions for me? I know there's a delay, so I don't want to end it with someone typing. So, but I want to thank you guys for joining me this evening and let you know that I'll be here next Wednesday. If you have questions, I'd be happy to answer them live for you. If you're watching this on the replay and you have questions, feel free to post your question below, and I can respond to it that way as well. And if you are looking for help with how to study in nursing school, then I want to encourage you to watch the workshop on nursingschoolmasterclass.com. You can watch the workshop on how to study. You can get information about how you can be part of our community, where I'm in there every day and every week helping students figure out, okay, how do I do nursing school? How do I make it less stressful? So, yes, okay, another question came in. Any tips on staying motivated? I'm in week 8 of clinical semester and I'm burned out already. Oh my gosh. Ah, yes. So staying motivated, especially at this point of the semester, it's really hard. It's really hard to keep that pace, and keep the enthusiasm and keep that attitude going of it's okay, we've got this. That's really, really hard, especially at this point in the semester. So first of all, just want to validate that that burnout feeling that you're having right now is completely normal and is being experienced right now by probably a million nursing students nationwide. So everybody is feeling that way. Burnout a lot of times happens because you are trying to keep a certain pace. Um, and you may even be feeling this gap between where you want to be and where you actually are. And that can be very frustrating. So you work really, really hard, you should be getting A's. You work really, really hard. You should be, things should be coming easily. And in nursing school, every week is a new challenge because it's a new topic. It's another test to study for. It's a new assignment that you're doing. There's just a lot of new all the time. So what works best is making sure that you think about the pacing of your week. So think about how your week goes, the flow of your week. So if you know that you have clinical on Wednesday and Thursdays, you're totally wiped out, then make sure that you're not putting the things that are hardest for you on Thursdays. Try to match your energy for the week, match your activities for the week so that you're doing the things that require a lot of thinking or a lot of physical effort, that you're doing those when you're alert, when you have the most energy, when you're the most pumped, when you have the best attitude. Really try to structure your week so that you're doing the hard things when you're the most likely to be successful at them, but also when you have the most energy for them. And sometimes that changes based on the week, but really taking that inventory of looking ahead. So every Sunday, look at your calendar. What's this week look like? I don't think I should book a 5-hour study session after clinicals, or I don't think I should book a whatever this activity was right after my test, because I know that after a test, I tend to crash and I need to make sure I give myself those couple of hours to take a nap or go for a walk or just unplug. So really thinking about, spacing your week out in a way that matches your energy and what your needs are. And then, of course, self care. So we know that for nurses nationwide, when you are taking care of others all the time, you tend to put your needs to the side. And so I'm sure it's the same for you in nursing school. You're putting a lot of your needs to the side, things that you'd like to do that you're not able to do because you have to do school. And so you need to make sure you have space in your schedule where you bring some of that back. So make sure you put some of that self care back in, even if it's just a little bit. And what's so awesome about the brain is if you stick it on the calendar and you say Friday evening, I'm doing this thing that's fun and interesting and something I enjoy that's totally not nursing school, that all week, every time you see that in your calendar, it will actually cause a dopamine release in your brain, which will give you a little boost because what we know is that anticipating something releases more dopamine in your brain than actually doing that thing. So, being excited about something or looking forward to something or seeing a break that you've given yourself in your week is a great way to stay motivated in the hard times. So, I would encourage you in that. So, thanks so much. I'm glad that was helpful. All right, guys. Well, again, please post your comments below. I'm happy to help you with that, and hope you have a wonderful week. And I'll see you next Wednesday. Thanks, guys.